So I'm in my 40s now, and I talk a lot, as you know, perimenopause and menopause. This is a crucial time for at least maintaining the muscle tissue that you have and the bone density that you have and the ligamentous and joint integrity that you have. But ideally, with the science and with the how our understanding of muscle tissue and the skeletal system or the skeletal system, depending on what area of the world you're from. Someone actually complained that I say skeletal.
Is that Canadian,
like,
do you think? What is that?
I don't know. That's how my teacher said it. It was like the neuromusculoskeletal system. So that's just how, because my teachers would say it
Tomato,
like that.
tomato.
So tomato. Okay. So musculoskeletal system. Maybe I don't know if that's American or whatever. So we know that this is important to maintain, ideally add on to as our sex hormones are in flux during that time. And there's a rapid change that we know that happens at menopause or leading up to menopause. The one thing that I have been trying to educate my community on more and more is this idea, and this is why I started off with form and full range versus partial, because we cannot afford to be injured in our 40s and 50s the way that we can in our 20s and 30s. Like, you can kind of be stupid in your 20s and 30s. The ego can get involved, as it was involved with me for many years. But now in my 40s, I have to be relatively stringent with my form, because taking me out of the gym now is far more deleterious to the impact that it's going to have on my body composition, on my hormones, on my mood, on my affect, on my sleep, all the things, than it might have in my 20s. So I wanted to talk a little bit about injury prevention. I have a couple of questions, but first I wanted to, do you have the same opinion? What is your thinking around injury prevention in general? And then we can kind of get into some of the specifics.
Well, it's funny because as you were talking, I'm thinking I 100% agree with this. And there's a reason why, people in their 20s, there's a reason why sort of the life's journey happens the way it does. Like, you kind of are off on your own, making your own dumb mistakes while you're young and resilient enough to deal with it. But as you were talking, I'm like, you know what? I actually kind of want to challenge this a little bit, because just because you're young and supple and can bounce back faster doesn't mean that we should be maybe as reckless as we are, and we kind of make light of like, yeah, go be dumb and like do CrossFit till you're dead in your 20s and then we'll fix it later. Because a lot of my clients, a lot of my friends, a lot of people in my community are still dealing with injuries they got when they were younger, are detrimentally impacted now in their later 30s, 40s and beyond because of quote unquote dumb stuff they did when they were young, because they could get away with it. That they never fixed.
Yeah.
And also that may have permanently redirected their lifestyle habits in a way that they're now suffering. So a very common story that I have, and this is not about calling people out or judging people, it's common. So if you hear yourself in this, don't feel like you're dumb, feel like you're part of a very large group of people.
Having a human
exactly.
experience.
Somebody who maybe we use CrossFit, or maybe people who did a lot of like endurance running or like long distance running or something. And so then they injured their knee or injured their hip or something. And then in your 30s, which is a period of time when a lot of people are progressing in their career, having kids, doing things like that, and oftentimes prioritizing maybe their fitness less. They go through maybe a decade where they're like, I used to work out all the time and fitness was my identity and I did all this and I did all that, and then I was injured and then I stopped. And now maybe I'm 40 and I'm feeling a little bit better and I want to get back into it, and I feel completely lost, like I'm starting all over again, instead of like sort of a secondary path they could have taken, where if the programming and the decision making was a little bit more intelligent when they were younger and they weren't beasting themselves because they were 25, maybe they could have kept going doing the sport they love this entire time. And they're enjoying lots of muscle mass and lots of energy and good functional movement because they didn't beat themselves into the ground. And, I have definitely had a couple stupid injuries in my younger years, so I'm not saying I am totally free of this, but I will say that one of the things that I think has kept me able to kind of maintain a consistent fitness throughout my 30s, and now I'm I have a big birthday, I have the big 40 coming up very soon, has been because I never let myself get to the point where I was overtraining, under-recovering, under-nourishing, and experiencing that very, very common roadblock that a lot of people do, where they just push too hard for the sake of pushing too hard, and they find themselves with injuries that don't seem catastrophic at the time. And then a decade, 2 decades later, they're still dealing with it, right? So I would argue if you're listening and you are still young and in shape, be smart. Don't wait to make your own mistakes in this particular instance. Be smart and protect yourself now so that you don't have to deal with it later on when it's harder, you know?
Yeah. And thank God for my chiropractors, because I have been under regular care for like the better part of maybe working on 30 years now. That's how I actually became a chiropractor. I was a patient first. And the other thing I'll add, just as a clinic, this is just my observation in clinic, is that individual who's pushing themselves so much in the gym is going to go to the chiropractor or the physical therapist or like some body worker, and they're going to go until they see some symptom resolution. And then they're going to stop. And then they're going to go back into the gym, and then they're going to re-injure themselves. So they just sort of wait until the pain is subclinical. So they'll wait until the acute pain is gone. I'm like, I feel better. Great. All right, we're done here. And then we're going to go on. So if it is, and I know that this is not available to everybody. So I sort of recognize as I hear myself saying this, I'm very lucky to have grown up in the chiropractic community where there was always someone that's like, hey, can I use your spine as like a testing ground for whatever Gonstead technique or whatever technique we were learning. So I'm blessed in that way. I mean, I guess it's also a blessing and a curse, because if you're the guinea pig spine, then you could certainly create some injuries there too. But I'll say that sticking with regular care of some sort, whether it's a regular adjustment, a regular visit to your massage therapist. I mean, these are things that I do. I'm regularly in my, and I have friends that I pay for. I do not say, hey, I know we're friends and just like, we'll just swap. I pay for the adjustment. I pay for the massage therapy. I pay for all the things because I do believe in their value. So just a little piece there is don't just stop care when it's subclinical. Actually reverse the movement mechanics, and working with the chiropractor or the physio or the whoever it is, the occupational whatever it is, they're really, or the osteopath I should say, they're really gonna help out there. Okay, great. What do you think about if you are injured? So for me, I would never stop working out, and maybe you're going to call me a tool, but I would never stop working out. I would just modify the workout, right? So let's say I injured myself on the squat. I'm like, all right, so instead of going to the barbell today, I am going to go to maybe I'll do the hamstring, like lying hamstring curl. I'll do quad extensions. I'll do some glute, like I'll do the abduction machine, or I'll do the glute machine. So I'm getting all the muscles that were activated in the squat, but I'm not necessarily doing the squat because I never wanted to have the time off or lose any progress that I had made. Do you agree with that, or am I an idiot?
You're an idiot, Stephanie. No. I absolutely think that you should continue training. I think this is where a lot of common sense comes in. This is where a lot of ego checking comes in. It can be very difficult for people who are used to training a certain way to not be able to train that way. But look at professional athletes, for example. Let's look at football. Football's on right now, and so that's very timely. And people are always getting injured in football. And these are like catastrophic ACL, Achilles injuries and broken ankles and stuff. Are they completely not working out? No, of course they're doing tons of physio and tons of rehab and tons of exercise. Is it hard and difficult and mentally challenging to hardly do anything when you're used to being an elite athlete? Yes, but that's where the consistency of your health habits and what matters to you. Does it matter to you that you can just go in and show off and lift heavy? Is that what matters to you? Then yeah, this will really suck if you can't do that. But does it matter that you're being healthy and functional and protecting this very important muscle for your health? Then yes, you can go in and continue to do all kinds of things. The common sense factor is is what you're doing hurting you? Does it hurt the injury? Stop doing it, okay? Because there's always an alternative exercise. There's always other things you can do. There's actually, I should see if I can find this, because there is actual research you may have come across too, that shows when people are injured, if you injure your left shoulder and you continue to kind of do full body workouts and work the other arm, the muscle on that injured side is protected. So you don't even have to do as much as you think you have to do. If your left delt is injured, speaking from experience, you don't have to keep gritting through shoulder presses to protect that muscle. You can do some other sort of accessory work, nearby work, even work the other arm, don't go crazy, whatever, but keep the blood flowing, keep the consistent routine going. It's good for your mental health. It's good for your physical health. It's going to help the rehab. It's going to help the other physio things that you're doing, help you sort of improve and heal faster. So yes, absolutely keep doing that. Ideally, to your point earlier, work with a coach or someone who is intelligent and experienced and knowledgeable about this kind of stuff to help with some programming so that you aren't going in and either wasting your time or hurting yourself. But yeah, you absolutely should do it. And I think one of the biggest benefits is going to be sort of the mental resilience that it takes to work through injury and to be consistent and to take care of your health instead of just do the stuff in the gym you like to do, you know?
Yeah. And I would say that, you know, to your point, the prognosis of the patient, the quicker that we're able to start replicating, at least activating some of the muscles, maybe in a different way, or at least the movement pattern so that we can correct the movement pattern. So I would have a lot of ankle, I would see a lot of ankle injuries. So the quicker that I could get them toe tapping, doing some heel raises so that we can kind of challenge it was usually the lateral side of you sort of sprain the foot, usually rolling on the outside. So when the quicker we could get them to calf raises, eyes open, eyes closed, all the stuff, the better their prognosis tended to be versus like resting it and not doing anything until they felt like they were ready to come back. So I agree with you on that. The other thing that I really like for injuries is blood flow restriction. I don't know if you've ever played around with that, but I find that to be wonderful. Yeah. Shoulder injuries in particular, it's if you can wrap it around wrap the blood flow restriction around the sort of just around like the top of or base of the shoulder, I guess you could say, base of the deltoid. I found that to be very effective for, again, like pushing the blood and pushing all the sort of the healing nutrients that we're trying to do into the joint that we're working.
I haven't done that as much as maybe I should, considering I do have my own sort of nagging, ongoing shoulder thing. I have played with it a little bit and I have heard some really good things, but it's an area that I actually probably should be exploring more.
It feels awful. So I'll just preface it by saying it is one of the more, I have the Katsu bands. So KAATSU, I believe is how it's, and they have this cyclical feature on it. So you wrap the band around the arm and then it sort of inflates. So it sort of cuts off the blood flow and then it relaxes, inflates. So I actually really like that because you're sort of it's a pulsatile program that helps to drive the blood flow into the area. And again, when we're talking about injury, like as a rehab tool, it's wonderful. As a prehab tool, it's wonderful. And even just if you wear it, sometimes I'll just sort of wear it as I'm doing housework, and my hands, like you really like the whole, like you get that sort of post-workout pump in the arm. It's really nice. So
okay, I might have to look into that.
Yeah, it's really cool. You mentioned undernourishing. So we were talking about injuries and you said, hey, if you're undernourished, probably, and I would probably say that most females, even at the athletic level, are going to be in sort of this low energy availability, like they're not eating enough. So I wanted to maybe transition a little bit from working out in the gym, because I know another area that you and I both really love to geek out on is nutrition. What are some of the consequences, short, like acutely, and then over a longer delta, of undernourishing, undereating? And I'm talking to the women who are listening that think that 1,200 calories or even 1,500 calories is an appropriate caloric intake as sort of maintenance.
There are so many consequences, and it's probably got to be the biggest challenge and focus of my work, honestly, period, is to get women eating more food. And, being in this industry, in the kind of bubble that we can be in, it can seem silly or unrealistic, or like I'm kind of preaching into a vacuum to say things like women should be eating more than 1,200, 1,500 calories, or you won't get bulky if you lift weights. But then when I speak to the general population, when I speak to clients who are coming to me who haven't maybe been in this world for so long, and that is still the narrative of, well, you can get away with, 12, 1,300 calories. I've been doing it for 10 years, or I don't want to lift because I saw this one CrossFitter who was super jacked and I don't want to look like that because that's going to happen to us all, right? Anyway, these things are...
One can dream.
Anyway, yeah. But yeah, it is still something that is really, really taught and ingrained. And I have a lot of empathy for women who have been told this because it's such a fear-based rhetoric, right? It's so much about if you get bigger, That's the worst thing that could possibly happen. And that's not a challenge or a fear that men have to deal with. We could make the argument that, their sort of similar issue is the opposite side of the coin of being worried about being skinny or not being big enough, right? And that's the challenge they have to deal with. But it's a really, really pervasive, overarching thing that eating more, being bigger, taking up space, being large, being a bigger size, weighing more is the worst possible outcome that could happen. And I could argue with you that having low bone density and getting early onset osteoporosis and sarcopenia and muscle wasting, which is going to have you at a higher risk of injury as you get older, losing your cycle, losing your period, having all kinds of hormonal disruptions, having no energy and mood swings and irritability and brain fog and trouble sleeping and low libido. I mean, this is just the tip of the iceberg. I would argue that whole host of symptoms, hair loss, all of these things are much worse than being a larger pant size, actually. And again, it doesn't have to be one or the other, but I think we are focusing our fears in the wrong place. Those are all things that happen when we undernourish. And I've had a couple clients even just recently who the biggest win that we've had has been getting them to pay attention to what they're eating, seeing just how little they were eating, especially how little protein. And over a couple of months, raising the protein, raising the calories, and their entire life changing. And this is not an exaggeration. The energy, the focus, the mood, their ability to go and have energy to actually work hard in the gym. Because that's the other thing. People who are doing this, I want to build muscle but lose fat at the same time, who are also doing way too much in the gym and eating way too little to support that work that they're doing. That's a problem. If you want to put muscle on your body, that means growing tissue. You cannot hope to grow new tissue on your body when you are not eating enough to support the daily functions of your body's operation system. And we don't think about that level of it. All we're thinking is, okay, well, if I eat this little, I'm not getting any extra calories. I'm not eating in a surplus. And so then I'm going to go and just bust my ass in the gym and I'm going to see this muscle come. That's not how it works. And especially not for women's bodies. Men can kind of put up with that a little bit better. And some women can too for a certain period of time. But it's incorrect information to tell women that they can get away with very, very low calories and work for 3 hours in the gym and think that functional, fit, well operating, happy person is going to come out of it. So that's, even more than lifting weights, even more than working out and finding all that beautiful, empowering strength that comes from it. The very first thing I work with people is how much are you eating? What are you eating? Are you eating enough? And let's work on that. So important.
Yeah, because it's something that everybody has to deal with on a day-to-day basis. We all have to figure out what we're eating. So we are always faced with nutrition decisions every single day. And I would say I love everything that you've said. And I think that there's so many, we've been talking a little bit about fitness influencers and, people online and stuff. And one of the things that, when you look at, let's say, fitness competitions or, people who are just people who are in the fitness industry, for women, about half of them don't have their menstrual cycles. And this is sort of normal. And let me, for the record, say that it is never normal not to have a menstrual cycle. Right. If you don't have a menstrual cycle, it means that you don't have enough body fat. You don't have enough tissue, as you were saying, on the body to sustain the necessary, whether or not you want children, necessary reproductive cycle.